Now, the difficulties of educating new nurses. The NewsHour's special correspondent for education, John Merrow, has that story.
Hi, can I take your order?
When Abby Advincula first came to San Diego from the Philippines, the best she could get was a job at McDonald's. But after 6 years, she wants more.
It stresses you out. Sometimes you're just like, don't want to go to work anymore. I don't want to be an assistant manager. I want to be a nurse.
To become a nurse, Abby planned to attend a community college, affordable, open places where anyone, regardless of wealth or background, can get an education.
Try not to contaminate the barrel.
More than half of all nurses come from community colleges. Abby Advincula thought she was in the right place at the right time. California's hospitals need nurses, and she's fully qualified. But San Diego City College put her on the waiting list.
Here you go. Thank you. Have a good day. Just told me, like, oh, you have to wait 4 to 6 semesters. I'm just frustrated. It's just like delaying my dreams 3 years. You've been thinking, like, I could have been a nurse, you know? And why am I still doing here?
All across the country, thousands of would-be nurses waitlisted at community colleges are asking the same question. What am I doing here? U.S. hospitals are desperate. Even though they're importing nurses from overseas, they still have 118,000 vacant positions. California alone needs 14,000 nurses right now.
Registered nurses at the bedside are the most effective healthcare providers. And right now, we're in a crisis and we're not able to provide that.
Debbie Berg is director of nursing at San Diego City College.
Give me a nice deep breath.
What's at stake is the healthcare of the people of our country.
Did I fill that in for you?
One reason for the bottleneck, teaching nursing is expensive.
Barbara, have your last med. I'm going to turn on the light here.
It costs 3 times more to train a nurse than it does to educate a typical community college student. But the California legislature does not take the cost difference into account.
Not the best thing in the whole wide world. Okay, you're all set.
The state pays us for what I like to refer to as butts and seats, is that we're paid literally by the contact hours, and we're all reimbursed at the same rate.
Terry Burgess is president of San Diego City College.
I could have a psychology lecture with 100 or 150 students in it and 1 professor, or I could have a nursing clinical with 10 students and 1 professor, and the state reimburses me the same rate for whether it's a nursing student in that setting or whether it's a psychology student in another setting.
It's all about getting students in the seats through the official count, which is about the 4th week of the term, and that's what they have to do to survive.
According to Nancy Shulock, a California college expert, seat count is critical. In California, community colleges compete with the K-12 system for state money.
In recent years, there's been a lot of focus on improving funding levels for K through 12. So you can't do both because of the way we've set things up in the state. You can't increase K-12 and increase community colleges because they're fighting for shares of one defined pie.
For every student enrolled in kindergarten through 12th grade, the state chips in about $7,000. Community colleges get only $4,500 per student. By contrast, the University of California gets 4 times as much, about $19,000 per student. For community colleges, which educate nearly half of all the undergraduates in the country, this means rundown classrooms, dated facilities, reduced services, and a reliance on low-paid, part-time faculty.
Hi, everybody.
In nursing, where small classes are required by law and labs and equipment are expensive, the pinch is particularly painful.
A lot of our stuff is antiquated.
Melinda Whitney is a first-year nursing student.
There's not a lot of models that we can work on. A lot of us are sharing things and we're practicing on ourselves. And okay, yeah, that's okay on some instances, but you don't have the equipment to use. So I think that definitely that's something that's lacking. Then we gave her her Paxil, which is an antidepressant.
The limitations become clear when student nurses begin their clinical rotations in hospitals.
You're having to get your teacher or having to get the nurse to kind of explain to you, okay, well, how do I use this machine? Because I've never used it. I kind of know, and I can maybe figure it out, but I have a patient's life on my hands. So it's not like I can sit here and be trying to figure out this, at the bedside.
You're not going to have to do cleaning, you're just going to do suctioning.
Underfunding also makes it hard to find nursing faculty. At the beginning of this school year, 1 out of every 12 nursing faculty positions nationwide was unfilled.
We usually don't like you to take those patients.
Pam Kersey McCandless teaches nursing at San Diego City College.
People go to school for a long time to receive a master's degree, and teaching they would make less than they would working at a hospital.
A lot less. A nurse with a master's degree can make as much as $100,000 a year in a hospital. Teaching nursing at a community college pays about half that.
We've had a position open for over 6 months, and we can't even get any applicants. So there's not enough faculty right now, but in 15 years, there's not going to be any.
My first semester, I couldn't get any kind of prereqs at all. I talked to a lot of people that just taken 1 or 2 classes. They need 3, they can only get 1. A lot of people don't make it in.
After 20 years as a carpenter, an injury forced Dave Reinders to switch careers. He too chose nursing, expecting his studies to be quick.
My 2-year nursing education is going to take me about 6 years to complete with all my prereqs and then my waiting period, and then finally the accelerated 2-year nursing program. It's kind of ridiculous.
Recently, California made an effort to shorten the wait, providing money to expand some nursing programs.
And we're part of a consortium of colleges here in the San Diego region, which did receive some funding to help to add some nursing slots, but it's really quite modest. I think we added 15 nursing slots to a class of about 100 or so.
15 more nurses will not solve the problem. As baby boomers get older, demand will only increase. 10 years from now, the United States will need at least 1 million more nurses. Yet thousands are left waiting.
Eventually, I'll see all the legislators, me or someone like me will see these legislators in my hospital, and then I can tell them what I think, as they're receiving low-level care because they didn't fund the programs.
Since John Merrow filed that story, San Diego City College has announced plans to expand its nursing facilities, and Dave Reinders remains on the waiting list for admission.